right, folks, third segment. So by now you've probably seen the numbers released by our provincial health authorities, the Premier, last Friday. And he outlined estimates anywhere from 3,000 to 15,000 deaths across Ontario, based on implementing all mitigating public health measures, such as the physical distancing and staying home if you're not an essential service provider. Now, 1% of the Ontario population lives right here in Brantford and Brant County, about 150,000 people. 1% of the numbers released Friday is an estimated 30 to 150 deaths. And those are not just numbers. Those are mothers, their fathers, their sons, their daughters, siblings, friends. They are people that you may know or be connected with in some way. And some of you who are under 50, you may think, I don't need to worry, Mayor Davis, this is a virus that only hurts those that have pre-existing health conditions or who are older, like me. Well, think again. The data coming out of New York City shows the largest group who are hospitalized for serious COVID-19 illness are those younger than 50. And my chief of staff, she's in her mid-30s and also one of those people who've tested positive for COVID-19. She became infected while on a Caribbean vacation in early March. She's been in quarantine since arriving back in Canada. So I haven't seen her in person since mid-February. She's doing much better now, recovering at home, and she's continuing to recover. She's a wonderful person. She's doing a great job as the mayor and CEO's chief of staff, and I really miss her, and I thank her for suggesting to me to share her story to, make it clear to younger people that, this can happen to anyone, and it's a difficult illness to have. So these are her words. I traveled to a destination in the Caribbean that at the beginning of March was zero risk for coronavirus. I returned home and immediately self-isolated, reporting my travel to the Brant County Health Unit. Shortly after returning home, I developed symptoms that originally felt like a bad cold, sore throat, headache, and feeling tired. Within 48 hours, I was struggling to breathe, my heart was racing, and I knew this was more than a cold. When I arrived at the assessment center, my blood pressure was skyrocketing and my oxygen saturation was low. I felt like I was drowning, just trying to breathe. This virus is scary. While it can be asymptomatic in some people or feel like a common cold in others, for many other people, the symptoms are far worse and very scary, and many of them young. I can't urge people enough to stay home. I am thankful that I self-isolated immediately after returning to Canada. As much as I miss my family, my friends, my job, and my normal life, and I really miss her, I'm grateful that our community has the resources to support people who are self-isolating. I know it can be challenging to balance parenthood, working from home, and keeping entertained, but we owe it to our parents, our grandparents, and our kids just to stay home. So that doesn't bring it home, what does? And again, I thank Sasha for having the courage to do this. So, the time for not taking this crisis, it's seriously over, folks. The time to follow the advice of our health officials and comply with all of the restrictions, regulations, and other orders in place is now. Any one of us can be a carrier without knowing, we've been infected. So you can still spread the virus, even if you don't feel ill or show any symptoms. So probably best just act like you have the virus so that you can protect others. And if you're not providing an essential service, stay home. I implore you, stay home, save lives. And when you have to go out for essential supplies, don't take others with you. Send one person from your household. And please, don't browse. Get only what you need and go back home as quickly as possible. Because, we owe it to the hardworking frontline people at grocery stores and pharmacies to do everything we can to help them keep safe as well. And if you know someone who, can't get out because they've got small children, they're a senior, or someone who has, serious pre-existing medical conditions, we'll offer to get them their groceries for them safely. And not every home has, 2 full-time parents. So, if you're in a position to help a neighbor, please do so. Stay safe, stay strong, Brantford. And remember, I talked last week about that tunnel that we're in. We got to keep it safe by doing all the things we're required to do because it gets us to the end of the tunnel a lot sooner. Thanks and have a good evening.